Hi, everyone. Welcome back to Medical Mondays. If you guys are here, thank you. Welcome back. If you guys are new, hi, my name is Dr. Jenny Lay. I'm a family medicine physician and a mom of two. And on Medical Mondays, we just hang out with each other. You guys can ask all of your medical related questions, non-medical related questions. Just drop them in the comment box and I'll pull it up to the screen and then we will just get started. So let me pull up this taking questions here. All right. So no questions yet. So I guess I will just start off by telling you guys I'm back from vacation and talk about mental health because I don't know, that's my thing. I've been feeling, I don't know, like not fully myself. Like I told you guys that I have these episodes where I feel like I'm just in a rut and I have zero motivation and I just stop doing everything besides feed my children and occasionally take a shower. But yeah, and so I just came back from vacation and I still feel like blah. And I don't know if it's because current events, I don't know if it's because work is just stable and there's been no change, or if YouTube has been no change, but it's just been kind of really, oops, sorry, not yet. It's just been kind of, I don't know, the mood is kind of low right now. So in medicine, we call that there's like, if you're having elevated moods, it'd be like mania and hypomania. So it's like a little bit elevated mood, but it's like mild, I don't want to say depression, but like mild depressed mood. But yeah. So let's start off with some questions. And Robert asks, how did you study in medical school? Did you go to lectures often? I personally went to lectures often just because my school did not record lectures and they only gave you the PowerPoint presentation. You would actually have to sit through the lecture to understand what they're talking about. I always tried to read the text prior to, going to lecture, but that wasn't always the case because there's so much material all the time. If I could go back, I think I would do more questions. Like when you're going through medical school, it's not actually how you study, but how you recall that information. So say you, it's called like active studying. So say you read through a paragraph of something, you recall it in your own words. And what's even better is if you write questions about it. So you dissect it, you see what is the most important aspect of this lecture, you write down questions for it, and then you go back later on and you answer those questions. And so a lot of people would do better if they do it in that way. It's the same theory as like Anki if you do that. So yeah, I went often, but if I could go back, and if it was recorded, I would not go and just listen to everything on double speed because to me, everyone talks very, very slowly. Okay. Okay, let's see. Hi, Lisa. I'm not on vacation anymore. I just came back this past weekend. Everybody got COVID tested. We all came back negative, and so that was good. And I start work again tomorrow. But yeah, I was supposed to do like YouTube stuff this week, and I didn't. I did vlog. If you guys are interested in seeing that, I went to San Diego, and it was just like a bunch of food and hanging out with the kids and my sister. So it was really nice. Okay. Yes, dysthymia. Thank you, Robert. Okay. Robin said, I'm a nurse practitioner in UK. Oh my gosh, you are definitely either a really early morning person or you're a super night owl because you can't sleep. I am a general NP, but in future I want to specialize. Can you give me any tips on how to choose a specialty? This is really hard because I don't know how school is in the UK. And I know that NP school here in the US, you don't get as much variety as you do, say, in medical school. Because in medical school, we go through different subspecialty training, and then you kind of experience all the different subspecialties. But I think for NPs, you do, it depends on what program you go to, but you have to like become a nurse and then go to NP school afterwards. And then usually you just shadow doctors, or you have to pick which one. And I would say that if you are more into surgeries and procedures, I know dermatology is a really good, fun one. You get lots of procedures. Orthopedic surgery is a really nice one too. Other than that, like medicine wise, you would have to like, I'm not sure what you're interested in. And everything else, I would say like it's more towards medicine. So all the fast-paced stuff is like emergency medicine, not dermatology, but it's more procedures, dermatology, orthopedic surgery. Those are more, a little bit more fast-paced. And then if you want more medicine, like you love the pathophysiology of things and you love explaining things to patients and the medicine aspect of it, I would say gear more towards like the other things like internal medicine, cardiology, and all that other stuff. But yeah, I think that the system in the UK is a lot different than the US, so it can't give you an accurate opinion on how, to choose. So people studying for the MCAT, first of all, good luck. And there is a right way to study. I remember this, sorry, let me turn off this clicker thing. So there is a right way to study. And the more questions you do, the better you do on the exam. There's been multiple studies that have shown this. I tried to do at least 10,000 questions prior to my board exam, step 1. For the MCAT, I think I took like upwards of 20 to 27 practice tests, just because the more practice tests you take, the better you do. You understand what kind of questions they're asking. There's only so many questions that they can ask, and there's only so many ways that they can ask it. So the more you do, the better you'll get at understanding what they're looking for. Also go through all the questions that you took, and read why you got an answer right and why you got an answer wrong. Sometimes you get a question right for a different reason, and then the next time they ask it in a different way, you get the answer wrong. And so rereading those and understanding why each question is correct will improve your score. What else? Anki is a really good one. I keep saying Anki, but it's like proven to help you retain information rather than cramming and studying that way. So check them out if you haven't already. I use lots of different tests, like officially from the website itself. I forget what it's called, but I took tests from Princeton and Kaplan and like Goldman or something like that too. So lots of different practice tests. But hang in there. Good luck. It's going to be over before you know it. Okay, next question. What symptoms do you typically see with when people present with severe vitamin deficiencies like B12, especially D? Specifically psych symptoms. And so generally with severe vitamin deficiency, especially B12, you will have more neuro defects. Like you can have neuropathy. You can also have anemia because B12 is like absorbed through the intestines or in the stomach. For D deficiency, you would have more of like fatigue. But I have not seen anyone, so the average range of vitamin D normal is like 20 to 30 and above. So I've seen people as low as like 9 and probably a little bit lower. And the only symptoms that they have found was general fatigue. And so we can look it up to date. If you guys don't know, or if you're not in medical school, Up to Date is a website in which all doctors from different subspecialties kind of put in information there. And it's basically the most up-to-date information. So I'm just going to log in real quick. Okay. So if you want to say B12 deficiency, let me share my screen with you. All right, can you see this? Okay, perfect. So this is the website that we usually go to for all doctors. All the standard of care is here. So you go B12 deficiency, and you can go down to symptoms, clinical manifestations and diagnosis of B12 and folate deficiency. And if you want to look up specifically neuropsych changes, we go here. So neuropsychiatric manifestations may be present in both B12 and folate deficiencies, although these findings are most commonly ascribed in B12 deficiency. Neurocognitive changes have been reported as well. So here are some of the things that people find. So depression, depressed mood. Yes, you definitely see that with vitamin D deficiency as well. Irritability, insomnia, cognitive slowing, forgetfulness, dementia, psychosis. And so all these other different things. Pediatric patients who drink too much whole milk after the age of 12, like more than 20 ounces, then it kind of, it prevents them from absorbing vitamin D, vitamin B12. And then also people who take like Pepcid or PPIs for chronically also have issues with absorption. So definitely something to look into if patients present with some sort of symptoms. So yeah. Hi, Jessica. And so I'm in the 3rd week of respiratory school, and I'm doing research paper on Meconium aspiration syndrome in newborns. Have you ever encountered this in patients? So for those of you who don't know, Meconium aspiration is just when a child is born and it had already pooped basically in the uterus. And so we are worried that the baby can inhale all of that, which can lead to pneumonias, sepsis, and all really bad things. Usually it happens when baby is further along. Sometimes it doesn't cause issues. Sometimes it causes really horrible issues. I have unfortunately seen several patients with very bad meconium aspirations. The last one I was at had to be coded, which means that the baby was born and it was not breathing as well. It's APGAR scores, which is what we describe as, here, let me just pull this up for you so you know what I'm talking about. So when a baby is born, we rate them by a number, and we call that the APGAR score. Let's see. Here. Chrome tabs. Okay. So these are the APGAR scores. We look for heart rate, look for respiratory effort, muscle tone, reflex, and color. And so my baby that was born had a low heart rate, below 100. The respiratory rate was slow and irregular. It had poor muscle tone, some flexion, but not actively moving. It would grimace to like stroking of the foot and stimulation, and it was pink in the body, but purple and blue in the extremities. And so it had a pretty low APGAR score. We ended up having to intubate this patient due to this meconium aspiration. And so I have seen it. It's, and that's why we have our OBs there. That's why we have our pediatric hospitalists there. There's always someone taking care of mom and then taking care of baby when we suspect that there's meconium. And how we can tell is that when mom is dilating, we check her cervix, and sometimes we break the water depending on how the water looks. Is it murky? Is it, do we see meconium? Is it clear? And all those things will give us signs to help prepare us for when baby comes. Okay. Mm-hmm. Oh my gosh, you guys have awesome questions today. Okay. So if I didn't go into family medicine, what specialty I think that I would have gone into? I just love everything about family medicine just because I probably have like a little bit of ADHD. So I have to like jump from topic to topic. And I feel that family medicine allows me to do that. But if I were not to go into family medicine, I think other fields that interest me are psychiatry. Like, I love helping people. I love being there to help aid in their vulnerable states. I feel like I've also learned a lot about myself in learning about mental health. But I would miss the procedural aspect of it. Like, I love doing procedures. And so I don't know if I would want to give that up. I love emergency medicine. I think it's very fast paced. It's exciting. You get to do lots of procedures. You see everyone from every walk of life. It's a little bit of primary care too, just because the way the American healthcare system works, it sucks. And so a lot of people end up going to the emergency department for like primary care because they're not able to get into a primary care provider. But what I don't like about that is that you rarely ever get to see the patient follow through with things like say if I had a really sick patient who I needed to admit to the hospital because he or she or they were having a heart attack. I don't really know like what happens to them after they get admitted. I don't know if they could become really ill. I don't know if they survive. And so it's really like, okay, I am catching the most dangerous things, but ultimately you don't really know where it goes from there. And there can be a lot of loss. And after doing residency and having to do like night shifts and switching from days to nights and such irregular schedules, like I just couldn't do it. Like, I'm an early morning riser. Like, I wake up at 5 a.m. every day to work out and then spend the rest of my day. Like, if I had to switch like all the time, I don't know if I can do it. So, but it's very exciting. I was also interested in OBGYN at one point, and I love pregnant people. I love talking to people throughout their pregnancy. I think pregnant people are so beautiful. I love advising people and first-time moms, and I love babies and all that stuff. But I really just couldn't do the schedule. Like, I can't wake up in the middle of the night and feel like I'm missing out on my own life to be a part of someone's beautiful moment. Like, I think that is so special and honorable to be part of somebody's delivery process, but I don't want to personally give up my family to do that. And also later on, I realized that I didn't really like gyne surgery. Like, I love the vaginal delivery aspect of it, but I didn't like that. So it's good for some people, not right for me. What else did I like? I also like internal medicine. Like, in hospitalist medicine, really, really fascinating. Like, there's like obviously the bread and butter stuff where it is acute coronary syndrome or asthma, COPD exacerbations, small bowel obstructions and things like that. Like, or people in the ICU. And I don't know, like I really enjoyed being on the inpatient basis, and the schedule was nice. Like you're on for a week and then you're off for a week. You work 12-hour days for 7 days and then you're off for a week. And so it makes for good work-life balance for shift work. But the thing that I didn't like about that is that I am treating something that is already too late, right? And so I am treating patients when they are already ill, and I wanted to prevent illness. And I feel like, I don't know, I get burnt out too, dealing with all the bureaucracy of the hospital medicine. Like the more you go into medicine, I think the more you'll understand, like there's lots of bureaucracy in medicine. But yeah, that didn't really answer your question, but all those subspecialties I did consider while I was a 3rd and 4th year med student. Okay. Well, that's a lot of questions. Okay, let's see. Whoa. Sorry. Oh. Okay. This is a good question. How do you tell the difference between mono and strep throat? So symptoms can sometimes feel the same because you are feeling really tired. You can have a fever. And your throat can somewhat look the same. So what we generally do is we do a strep test, which is a rapid strep test. We swipe the back of your throat and then culture it and seeing if you grow like the strep virus. Some people, like myself, are basically colonized with strep in their throat. And so that is not very accurate. And mono, you could do a mono spot test. And this is more of a virus. It's due to Epstein-Barr virus. I believe, let me double check. I believe, oh my God, it's been a while. Sorry, guys. Mono EBV. Yes. Yes, that's correct. Okay. Sorry, I doubted myself for a second. But a way that you can tell is that if you give the medication for strep, which is generally like Augmentin, for someone who has mono, they will break out in an all over body rash. That might be a board question. But yeah, and then mono has that enlarged spleen sometimes. And that's why we say don't play contact sports because it can blow your spleen. It's very dangerous. So yeah. Okay. Austin, hi. Do you work in private practice or are you part of a hospital system? What are the pros and cons of each? I am currently in a hospital system. I'm part of a larger hospital system. Private practice, I think, is an awesome way if you want to make more money. And you can buy in to be part of their system, but everything is outsourced. So you don't have as much connections as in a hospital. In a hospital, you already have like x-rays and CTs and MRIs and mammograms and blood draws and all that stuff. In private practice, you might have to be basically like contracted with people, and sometimes it's not as cheap. Sometimes insurance companies don't like to pay for it, and so there's little nuances on that. But for me, in a big hospital system, I feel like they don't pay me as much. And so I feel like if I were to go into private practice, then they are more willing to give you a bigger cut of what you bill. And then they also kind of like let you buy into the practice after so many years. So if the company is doing well, then you would get a bigger bonus. I don't get that at a hospital system. So yeah. But I will ask some of my friends who are in private practice, and maybe I can address this question again to give you a more thorough answer. All right. This is a good question. How long does the vaccine last? Why do we have to wait 8 months for a booster? Okay, so we don't know yet. We don't know yet how long the vaccine lasts. We know that there is some waning immunity, but the studies out of Israel is still showing that the vaccine prevents severe illness of, like, say, being hospitalized, needing medical intervention. And we will only know until like time passes and people become more infected. Right now, I think it's more of a political thing that people want boosters. I don't know if, because they were saying like the most vulnerable population, if they're having waning immunity, we should give them a booster so that the healthcare system does not get overwhelmed, as well as doctors and healthcare workers who are working in medicine. If they get severely ill, then we wouldn't be able to take care of patients, and hence a booster would help. And so I don't know why they chose 8 months, but like, if they offer to me, I'm gonna get it, because I feel scared of the new variants, and I want to be protected, specifically for my little children who can't get vaccinated yet. But it's not like if you don't take the vaccine that they're going to ship it to another place to give it to people who are in need, right? And so I feel like those vaccines are just going to go to waste. But yeah, I don't know why. I really don't. But I know that they are safe to take a booster. This is very common for other vaccine series like Tdap and other things in childhood. And so, yeah. I see this question a lot. Can I donate blood after getting the COVID vaccine? Yes, you can. And so let's try to pull this up right now. Share screen and new tab. Okay, so let's see. Red Cross. Is it Red Cross where you donate blood? Yes. Red Cross. It says here. Maybe I'll go back. Can I donate blood after COVID vaccine? Yes. With the ongoing pandemic and Red Cross. Where is it? It says so right here. You may still donate blood, platelets, plasma after receiving COVID vaccination. And this is directly with like Red Cross. So I would say yes, that you still can. I don't know where that came from, because yes, I had a patient tell me the other day too that she didn't want to get the vaccine because she still wanted to donate blood. And so, yeah, I checked before and it said that you can. So, yeah. Let's see. Let's see if I missed questions up here. I am so happy. Okay, so when people tell me that they want to pursue family medicine, it makes me like super happy, because I feel like it's one of the most underrated best specialties, and we need more primary care physicians. There's definitely a need for it for patients. And it says here, any tips and advice would be helpful. So I don't, Laura, I think I need more clarification. I think that you need to go through a whole process to apply to US family medicine programs. I would say applied to a wide variety of programs and see what you get in to, and then you can narrow down from there. It's better to have options than to regret it later, right? And so I would say that it puts you a little bit disadvantage for being a non-US medical graduate, but there's always like the interviews and the personal statements. And so there's more to you as a student than just the title of like IMG, right? There are some programs that accept more IMGs than others. And so definitely look that up. I think my program, one of our best nocturnists, he came from a Caribbean school. And so he tends to pick more or is more open to IMGs itself. I personally went to Skagit, and that was an internal medicine program though. I know some schools in Washington, I would just say applied really widely. Okay. Okay. So back to the COVID vaccine, about the conspiracy of why you can't donate blood after getting the vaccine, is that some protein in vaccine prevents protein or increased white blood cells, thus can't donate blood. That doesn't really make sense of how the mRNA vaccine actually works. Like, it's an mRNA vaccine that codes for mRNA, and that is very, very fragile. And that's why it has to be held at like below freezing levels, like below 90 or something like that. And after you open it, it basically expires in a matter of hours. And in your body, it only lasts days, 2 weeks, 2 weeks at most. And so it activates an immune response. It can possibly cause a small increase in white blood cell count that is transient, which means that it's very short-lived because your body is building up an immune response. But you can also get elevated white blood cell count with any sort of stress or trauma or depressed mood, a variety of things, inflammation. And so it's really hard to say that that is linked to the vaccine itself. And so that doesn't really make sense. Yeah. Okay. Oh my gosh, Tara, please finish your antibiotics. Do you have to always finish antibiotics even if you start to feel better? Yes, please, 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 please finish your antibiotics. And the reason why I say this is because you will generally feel better after antibiotics for 1 to 2 days. And the reason why we do a full course of antibiotics is because you want to really kill off all the bacteria there. And if you don't kill off all the bacteria, some of them can become resistant. And that is what we're always scared about, that you will form bugs like MRSA or something like that, that are resistant to antibiotics. So in the future, if you become infected again and we give you this antibiotic, it's not going to work. And so please, please take all your antibiotics if it is prescribed. Okay. All right. Can you compare internal medicine and family medicine? I feel like every time I do a live, we talk about this. And so I have a spiel already. Internal medicine and family medicine, both of them are essentially primary care providers. And in both, you can work either on the inpatient or outpatient setting. For family medicine, generally, we are more on the outpatient setting. We see a variety of patients from children, newborns, to geriatrics, palliative care, and death. And so we see everybody in between. Internal medicine, you generally see more of the chronic patients and more complex patients, say like with diabetes, hypertension, AFib, all wrapped into one. The population is a little bit older. People who go into internal medicine, as you state, like want to subspecialize. About 70 to 80% of people who go into internal medicine already know that. And so they go into hematology or rheumatology, cardiology, gastroenterology, all the different ologies. And the other ones end up working hospitalist medicine. A few will work on the outpatient setting. And so that is the main difference. If you know you want to specialize, then you go into internal medicine. There's other things in family medicine that you can subspecialize in. So if you're interested in pediatrics or OB patients, then go the family medicine route, because internal medicine doesn't have those patients. And so family medicine, I would argue, has more small procedures. Like in my clinic specifically, I do lots of skin biopsies, from like shave to punch to excisional biopsies. I do lots of knee joint injections, ankle, knee, shoulder, wrists, tendons. I also do toenail removals, spraying, like cold spraying stuff, trigger point injections, and lots of other things. And so I feel, colposcopies. And I feel that internal medicine doesn't have as many. They have the large procedures that you do on the inpatient basis, like paracentesis or thoracentesis, which is pulling fluid out of the lung or pulling fluid out of the abdomen. But you don't have those smaller procedures that you generally do in clinic. Or doing a central line, you're not going to do that in your clinic. You will definitely do it on the inpatient setting. But it's not very procedure heavy. And if you wanted to be procedure heavy, then you would have to do internal medicine residency for 3 years, do cardiology residency for another 3 years, and maybe interventional cardiology for another 2 years. And so that's a lot of schoolwork and advanced medical education to do procedures. But some people really like things like that. So yeah. In family medicine, subspecializing, I forgot to mention this, but you can subspecialize in things like emergency medicine, sports medicine, palliative care, high-risk OB. So you can do surgeries on your OB patients and gyne surgery and all that stuff. So love the diversity in family medicine, and love the type of work that you can do. I was really considering just doing OMT for a long time, and now I'm really interested in like obesity medicine. So I incorporate all that into my practice, and obviously gyne stuff. Like I love women's health. And so yeah. Next question. Okay, lots of questions on like sending your children to school with all that is going on right now. So thoughts on sending a toddler back to in-person school with a newborn at home. A 3-year-old had COVID in January and baby is breastfeeding. So hopefully getting antibodies from my vaccine risk level. I think it really depends on how transmission is in your area. Like my area specifically has a very high vaccination rate. Like I think it's like 75% vaccinated individuals. So I feel a lot more comfortable sending my children to school, given that your 3-year-old had COVID already in January, it's likely that they have some protective antibodies already to the new variant. And so even if they did get sick, it is less likely that they will pass it on to you or your family. That being said, I also think that schools that practice good social distancing, hand hygiene, and masking are less at risk for those who are just like, it's fine to do whatever you want. And so really, you have to see what the risks are. I personally am, as I said, sending my children back to in-person school because of the lower risk that we have in this area. Like most of the people here are vaccinated. I know a lot of the families within the small Montessori school that he goes to, all of them are vaccinated. And so less of an issue. But if I lived, say, Florida or Texas, I'd probably be like, nope, you are homeschooling this year. And so, yeah, you would just have to determine your risk of transmission in your area. Okay. Okay, so these are a lot of questions, Linda, wrapped into one. So these are all different types of inner ear issues. And so these can be, yes, so some of these things that you are experiencing, like the hearing loss, sometimes depending on what is causing it, the ear, nose, and throat specialist can inject some prednisone straight through the eardrum, which decreases the inflammation. Vestibular migraines, it depends on what is causing them. What are some of your triggers? When I have anybody with any sort of migraines, I tell them to keep a migraine diary to see, like, when did your migraine start? How long did it last? What were you doing at the time? Were there any triggers? Like, were there any smells? Did you eat anything? And did you take any medication? And based on that, did it get better? And so keeping that diary will help you identify what kind of triggers you have to avoid them in the future. As for vertigo, it's hard to, like, we don't know what the cause of vertigo is. Sometimes we can do the Epley's maneuver to help, and I tell patients to do that at home. So I'll show you what the Epley maneuver is for those of you who don't know. Let's see. So vertigo is different than dizziness, different than lightheadedness. Vertigo specifically, it just means like you feel like the room is spinning. It's very disorienting, and it can cause you to throw up, lose your balance, and you feel like you're dying sometimes, and it could really mess up your life. Some people prescribe meclizine, which is like it's kind of like a motion sickness, but it doesn't really work, or it doesn't work well, I would say. Anyways, so this is the Epley's maneuver that you can do at home for yourself, depending on which way the room is spinning. And so I have done this a lot for my patients in the clinic when they come in and they're like, oh, I feel like the room is spinning. And obviously I do a full neuro exam to make sure that they're not having a stroke in any sort of way. And then I do like the Dix-Hallpike maneuver, where I like lean them back and then turn their head if they have like horizontal nystagmus. It's a positive indication. And so those are all good signs that it just might be benign positional vertigo. But what it is we think that sometimes the ear crystals come out of this, thing. And then when your head is moving, your crystals tell you where you are in space, right? So you're moving and the fluid in those crystals tell you like, okay, we're moving and then now it stops. But if the crystals are out of place and you turn your head and the crystals still move, then you're like, oh man, I'm still spinning. And so the direction in which you turn your head will help put the crystals back into place. And some people, like, the crystals are misplaced like more often than others. And I don't know what causes that, or we don't know what causes that. But you can do this at home. But yeah, my dad had this and he was just like, oh my gosh, I'm having a stroke. Okay. Let's see. So do you need to have all letters recommendations from FM physicians in order to apply for family medicine residency? I would say no. When we are looking at letters of recommendation, basically we want to see like how it would make up for other things. So when we're looking at residency applications, like med school applications, we look at the application as a whole, right? And so we look for people to fill a team. And we look for people who are like good leaders, obviously, but also people who are good team players. And so when you ask your doctor to write about you or like a letter of recommendation, have them really, really know you. Like, what are some of your best attributes that make you a good family medicine doctor? Or what types of attributes make you a good team player? Or how are they able to give an example of how you overcame diversity? Things like that. Not every letter has to be from a family medicine physician. I think each letter should show like a different part of you and how it portrays a different part of like who you are as a person, right? So one physician talk about like your leadership skills, another person talk about like your teamwork skills, and then another person talks about, you know, like how you handle challenges and all that stuff. And so I think that that's more important, like the context of the what's in the letters is more important than who it's actually coming from, if that makes sense. Let's see. Hi, Alice. If a pre-med has a specific interest in matching integrated plastics, do you think it's wise to exclusively apply to MD schools because of the res director bias? I've watched videos on YouTube that say this. Thoughts? I would say that you should apply widely and then pick as you go, because you might not be able to get into MD schools. And I still have a classmate of mine who matched into facial plastics and who is a DO student. So it is not impossible. Yes, there may be some bias and you may have to do better on board exams to, you know, be considered. But I would say that still apply widely, because some people think that they want to go into a certain field and then maybe sometimes they change their mind. And so don't limit your options so early when you haven't experienced the full scope of medicine yet. And maybe you're really determined that that's what you want to do. But I would still say that you'd rather have options than not have options, right? Okay. Other questions? Let's see. How is everybody doing? Is it still summer where you're at? Like, I feel like it's getting a lot colder here. Okay. You guys have no other questions? I might call this a night. Okay. Sorry, going back to some vaccine misinformation. Some people with weaker genetics will have different effect after the vaccine, right? Like fever, and some doesn't. I wouldn't say, I don't understand what weaker genetics would mean. I know some people have genetic disposition to be at risk of like early cardiovascular disease, or say like diabetes, or like a genetic disorder, like a gene like BRCA gene for breast or ovarian cancer. But I wouldn't say a weaker gene in general for immune response. We have no data that shows that. There are some people who get a fever and who have muscle aches, body aches after getting the second dose of the vaccine due to like you building an immune response. That's what we call just reactogenic, which means that your body is reacting to the vaccine, which it's supposed to do. And so it doesn't correlate to whether you built up a better immune response or a worse immune response. We just know that even though people who were like didn't have any symptoms after the 2 doses of vaccine still had a really good antibody response, like they had good immune response. And so we don't know why some people reacted and some don't. But I don't think that it is linked to genetics. We originally thought that COVID itself were affecting more of this high risk patient population where they had more comorbidities, but now we know that that's not the case. Like I see young, healthy, with no comorbidities, not obese, in like their 20s and 30s who get really severe COVID. And so not sure. We don't know why. Okay. It's fall. It's cooling down where I'm from. Where are you guys from? I'm here in Washington, and it was, I think, I guess it's still 73 here, but it definitely felt a lot cooler than where I was. So I was in San Diego. Yeah. Okay. So it is definitely slowing down. So I am going to call it a night. Let me know what you guys want me to talk about in like these future Medical Mondays. Like I kind of just go with the flow, whatever you guys want to talk about. So yeah, I'm like more than happy to talk about anything. I also want to make like specific videos. Someone requested talking about like thyroid disorders, how we manage them, and the different effects of like thyroid medications, and different medications would affect thyroid medication. So I think that that's a series that I want to start doing, like talk about a lot more about medicine, the common questions that people may have. So yeah, just let me know what you want me to do about that. Oh, Jenny. Okay, last question, because I really want to talk about this. I feel like I can talk about this all day, but how do you encourage patients to get the vaccine when all the news headlines talk about the side effects? I talk about, well, I really start off by listening to their fears and their concerns about the vaccine. And I answer all their questions and tell them the most evidence-based, medicine that we have in support of the vaccine. I never force anybody to take it. I say like, here's the information and you decide whether you want it or not. But every single time I do ask them, and I give them the opportunity to ask questions. I think that with what we're seeing in the hospital now, it's so sad. Okay, I'm just gonna tell you guys what's going on, but So we have been admitting a lot more pregnant patients into the hospital. And very rarely would we be able to save both mom and baby. And right now it's like 73%, I think, of pregnant people are not vaccinated. And it's so hard because this is due to misinformation. The majority of these patients are not anti-vaccine. They are just scared, rightfully so, and they do not want to harm their baby, rightfully so. And so with the information that they have, they are making the best choice that they can for their bodies, and their baby and their future children. And so it really frustrates me, seeing all the things that I am seeing, and then seeing misinformation continue. So that's why I'm still here on social media, still trying to talk about it and trying to put out accurate information. But I think coming more from like a kind place, coming from a place of trying to understand each other instead of like attacking each other, I think that they'll hear you more. I just don't want it to get to that point where people are like, oh, please don't make the same mistake that I did. I lost a loved one, so learn from me and all that stuff. Like, that didn't have to happen. We didn't have to lose children. We didn't have to lose pregnant people. We don't have to lose all these people for someone to finally realize that, it's misinformation, that this stuff is important. So yeah. Yes, you can definitely deny being weighed. You're like, I just don't feel comfortable with that. I don't want to be weighed. And so I do ask that my patients be weighed if we're talking about like obesity medicine, if they want weight loss medications, or I just talk about diet change in general. And so, but if patients feel uncomfortable with that, I'm not going to force them to get weighed. So you can definitely tell your doctor that you don't want to do that. Hi, Alex. I do take call as a family medicine physician, but I share it amongst my colleagues. And so there's about 6 of us in the particular clinic and then multiple other clinics. And so I take call approximately twice a month, one on a weekday, and then I think, 2 on a weekday. And then every other month for the first year, I do Saturday clinic, which is like I work on Saturdays to increase access to some people who can't attend or meet their primary care provider during the weekdays. And so on those days, I get to exchange a day. So say if I'm working Saturday, I don't have to work Friday. And then I'm on call like the whole weekend. And so usually there's not much that I can do as a family medicine on call. I don't have to go into the clinic or anything like that, but I do advise people. Like, I had a patient call in because she had an all over body rash, and then she had a swollen tongue and things like that, like worried about, angioedema or anaphylaxis or something. And so I advise them, like, take Benadryl, go to the emergency department. There's really nothing you can do on the phone. So you really analyze, is this urgent or is this not urgent? Does this require medical attention right now? Or can they wait till tomorrow morning so we can try to squeeze them into the clinic? And so it's not too bad. It was worse during residency. The worst call, okay, story time. The worst call that I had was from a patient who was not even in state. And so if you guys don't know this, if you're not in the state that your primary care provider is, like, that primary care provider cannot advise you if they're not licensed in that other state. And so I got a call from this person, and it was like 2:00 in the morning. And they're like, I'm not going to make it to Dr. So-and-so's appointment tomorrow. And can you please tell them that I am so sorry? And I was like, what? You were calling me at 2 o'clock in the morning to tell me that you're not going to make your 9 o'clock appointment. Like, why? Why couldn't you wait? And so, yeah, that was residency. I haven't had any patients call like that as an attending. But yeah, it's not that often. And so if you're worried about it, I would definitely ask, obviously, like if you're private versus a hospital base, like maybe you take more call if you're private and your practice is small. So it would just depend. All right, everyone. Thank you all for hanging out with me today. I love talking to you guys here, and I feel like it is a lot more like personable and, you know, interacting with you guys directly. I hope you guys like things like this. But I will be coming back with videos hopefully next week. Let me know what you guys want to talk about in the comment section below. But yeah, heart. Peace. See you guys.